Yeah, just a quick review, the OrthoMen OA unloader knee brace. So OA is probably osteoarthritis. There's different types of arthritis, but OA is the osteoarthritis, which is wear and tear arthritis, which is the most common kind. But anyway, this brace is basically it's made for people that have knee pain or struggling with some type of knee problem. And the idea here is that you put on the brace and it supports the joint and surrounding soft tissues like the muscles, and it restricts your knee motion a certain amount. So that way your knee has a chance to rest, recover, and it doesn't get so stressed out as you're doing things. So a few points about this particular brace. It does have 13 range of motion blocks, which means that you can limit the motion. Like if you don't want to, if straightening your knee out all the way is something you don't want to do, you can actually set it so this brace won't let you do that. Or if you only want to bend back so far, this brace can limit you as to how far you want to bend your knee back. So that's really good. It does have quick release buckles on it. So the good thing about that is it's not just that it's easy to get out of, but once you've got these straps adjusted where you want them, you can just hit the button, okay, and then it's quick release. But when you put the thing back on and you snap it, it's already basically set to where you want it to be set. So that's the value of those. Last thing to know about this is that it is one size fits all. So just kind of know that. That might bother some people that they want braces that you need to measure and get more specific fit. But anyway, this one is one size fits all. Anyway, so if you have knee problems, knee arthritis, whatever, there are some other things you can do. I'm getting this from Bulletproof Your Knee, one resource. Basically, if you're having any kind of knee problem at all, make sure you're strengthening your quadriceps muscle. Let me tell you why. Your quadriceps muscle is a group of 4 muscles here, collectively called the quads or the quadriceps. And there's your kneecap for reference. So it sits up above here. Quadricep muscle is the big stabilizer of your knee, okay? So it stabilizes your knee so nothing can happen to it. But researchers are finding that, if you take people with various knee problems and you muscle test all the muscles around the knee, basically it's just the quadriceps muscle that takes a big hit. In other words, it's not as strong as it should be. And some of these studies are doing like CT scans and looking at cross-sectional area. They find it's actually smaller than normal. So, for instance, knee swelling in the quadriceps. Another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, that's just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So if you have any kind of chronic or acute swelling in there, it takes its toll on your quadriceps muscle. It can't contract like it should. Knee injuries in the quadriceps, if you've had any kind of, fractured your, broken your lower leg bone, your tibia, surgical opening of the knee joint, if you've had any knee surgery where they opened it up, researchers find you probably have some decreased quadriceps strength. Ligament problems in the quadriceps, anterior cruciate ligament, that's your ACL. You've heard of football players tearing their ACL. So look at this. One study showed that people who completely ruptured their ACL, researchers found the strength of the quadriceps muscle was in the injured leg was decreased by 25 to 30%. So here again, you take a muscle that's the big stabilizer, you've knocked its strength down over a quarter, 25, 30% of its strength, you're compromising a lot of knee stability. It's really hard to get stronger and back to normal unless you build that back up. Posterior cruciate ligament, medial collateral ligament, same kind of things. Knee pain in the quadriceps, when they look at people like with chronic pain, they have like decreased quadriceps strength. Knee arthritis. So if you Google like knee arthritis and quadriceps, it's very, very consistent in the research that people with knee arthritis have weaker quads than they should have. And likewise, there are randomized controlled trials showing if you take a group of people with knee arthritis and you strengthen just their quadriceps muscle, their knee pain starts to go away. There are lots of randomized controlled trials on that. And interestingly, some of these studies are also showing that the people that have the stronger quads, when they look at people have the strongest quads have the least progression of their knee arthritis over time. So you got a lot of good reason to do at least one exercise a couple times a week for that muscle. Patellofemoral pain syndrome, it just keeps going on and on and on. Have any kind of knee problem, definitely make sure that you strengthen your quadriceps muscle. Fine-tune control over your knee. Here they're talking basically about the hip muscles. Sometimes the problem, you have really bad knee pain. The problem has nothing to do at all with your knee, how it's working. It's basically up at the hip that's the problem. So a classic case is like iliotibial band syndrome. Take a bunch of people with iliotibial band syndrome, and you strength test the muscles around the hip. You find they have unusually weak hip abductors. Now, the hip abductors keep your pelvis level as you take a step. Also brings your leg out to the side. So likewise, just like with knee arthritis, they find take a bunch of people with iliotibial band syndrome and you strengthen their hip abductors, iliotibial band syndrome starts to go away. So There you go. That's the problem there. Optimize knee flexibility. Well, we all know your knee has to be able to bend and straighten. A lot of people don't know is that your knee actually rotates as well. There's a third motion. It's called an accessory motion. So about the last 10 to 15 degrees of you straightening your leg out, it actually has to rotate laterally, which is out to the side. And here's a little test to see if you have that accessory motion, which is really important to have a fully functioning knee. Last thing you can always work on, increase dynamic knee stability. Here they're talking about proprioception. So if I turn the lights out now, all of a sudden, you'd probably be able to tell me whether your knee is bent or straight. And that's because you have these receptors in the knee, in the knee joint and in the knee muscles, and that constantly give your brain feedback as to where your knee is in space. And that way, you know exactly where your knee is at all times. Well, so when researchers go around looking at people with various knee problems and they test their proprioception, they find it's really not what it should be. It's not like people don't know where their knee is, because that would be like a neurological type of issue, but it's just not really as normal as it should be. So that's something you can actually improve with a few exercises. But hey, nothing's as good if you have a knee pain. Nothing's as quick as putting on a knee brace. A lot of people report they put it on, pain goes away drastically. So it's an interesting brace. I really like the range of motion block. So check it out.